sensation, and instantly what comes to mind is, oh, that's a bad thing. And I'm sure at some point it can lead to being a problem. But speaking of the body from that problem solving first, a complex adaptive perspective, could you just speak to your thoughts on how and why the body compensates? And I know this could be like a multi-lecture series. Oh, this is how, you could compensate this way, that way. So maybe just, keeping things just as base layer as possible, but how and why the body compensates. And then when does that actually become a bad thing?
So let's kind of define what a compensatory strategy would be. Okay. So what we want to do is we want to do this comparatively. So what we would say is we could use like textbook averages of ranges of motion. Okay. And that's going to be our comparator. And under those circumstances, so what people might say is that these are norms, and I would respectfully disagree that they're not norms, they're averages, because people's ranges of motion are idiosyncratic to the individual because of their structure. But if we lined up, enough people and we measure them all, we come up with this textbook average. So there's our comparison. And this we would say would be a representation of relative motion. So relative motion would be the ability of what we perceive the segments of the body to move in opposition. So if we're talking about a knee, it's the fact that the tibia can externally rotate and the femur can internally rotate at the same time. And so we have these segments that can move in opposition. In a circumstance where we would then join segments together and they would move as one. So instead of having a knee joint that would have its relative motion, we would achieve a position in which those two segments would then move as one. That would be a compensatory strategy because it's trying to solve a problem that relative motion cannot solve. So in the case of the way where this really shows up is in the case of trying to increase force production. So relative motion has a dampening effect on force production. So I cannot produce maximum force in a situation where full relative motion is available. So compensatory strategies are part of normal movement in all cases where force production has to increase. So I might see a decrease in the relative motion of any joint in any circumstance where force production has to increase. If I'm taking the milk bottle out of the refrigerator, I have to limit how much elbow range of motion I have as I'm pulling it out of the refrigerator. Well, if I'm reducing the relative motion intentionally, this circumstance arises all the time. In athletics, where the forces are exceptionally high, if you're not compensating, you're probably not performing well. So we can't classify compensation as a good or a bad. We have to say that this is part of the solution to a problem. So it's normal. What I want to be able to do is recognize when it's happening and when it becomes useful from a performance standpoint, and then when does it become interference? Because if I use too much compensation, then I can't dampen forces. This is a lot of cases where we'll start to see maybe pain arise or an injury. But if I start to carry around these compensatory strategies and I can't release them and I can't recapture relative motion would be a system that can calm itself. It's a situation where I can dampen the typical forces throughout the day. But again, if I'm in a circumstance where I can't do that, now I start to put load on structure. Because think about this for a sec. Take a lumbar spine that supposedly has 5 movable segments with discs in between. Typical compensatory strategy is going to be an anterior orientation of the pelvis, because what the advantage there is, if I anteriorly orientate the pelvis, I can push down into the ground harder. But to do that, I have to take 5 movable segments and I have to jam them into a single segment. So the lumbar spine becomes a single entity. It becomes one structure instead of 5 different structures. Okay. But to do that, I have to increase the load on that structure. Okay. Great for force production if it's temporary. If I walk around with that same strategy, because I'm training it more and more and more, and I'm getting closer and closer to making that my typical strategy, because there's a performance related advantage for me to be able to recruit that strategy very quickly. But if I walk around with it, now that pressure exists all the time. And there are negative secondary consequences to pressures and tensions. I reduce blood flow, right? I cause destruction of tissue over time. This is how things like facet arthropathy would occur. This is how you would get discogenic changes this is load on a joint that doesn't allow normal blood flow, and I get degenerative changes in a joint. So there's this fine line between where these things are exceptionally useful, occur in normal circumstances, but then become detrimental when they do become the norm, and I can't make the favorable change back towards a system that can dampen those forces and calm itself. So again, we can't say it's good or bad. We have to look at, say, what's the context, right? Because again, if I'm trying to raise someone's performance, I better have a good compensatory strategy to do that, because it's going to show up in all cases of performance. But again, if it becomes interference, if I start to give up something that I need from a health standpoint, that's going to be a negative secondary consequence, right? If I take somebody too far into a performance realm, I can create a negative secondary consequence where I take away a performance-related component that they needed to perform. So, quick example: take away a baseball pitcher's shoulder range of motion because I've driven them too far into the force production side of things, and now they can't even achieve the desired position that would allow them to achieve maximum throwing velocity, right? So again, that's where it starts to show up. The way we track these things is, number one, we have to have an intention, which is the desired adaptation, right? And so we have to understand, okay, how does the system adapt in certain circumstances? So if I drive force production too far in one direction, am I taking something away that they need from a performance-related perspective or from a health-related perspective? Now I do have a detrimental compensatory strategy, right? But we have to understand that compensations are absolutely normal. You use them every day, whether you recognize them or not. The question mark is this helping me temporarily, or is it going to become interference? And that's the hard part of the job, right? Because we have to intentionally move people in certain directions under certain circumstances because we're trying to create a performance-related outcome. But we don't want to be the cause of something that takes something away that is so necessary.
I think it's so